Hi students, hope you all are doing well. So today we will discuss GTT. It's not only for students, it is also for their families, seniors, elders and most oftenly friends also. So what does GTT mean? GTT is glucose tolerance test. Patients or students which have sugar patient in their family, they must know what GTT is. They all go through the test regularly. So GTT means glucose tolerance test. And here you can see the nephron. What does it do actually? It actually filters or absorbs impurities in our urine and make them convert to the excretory system urine, which passes throughout our body. So urine is produced in this part, in this network-like part, then it's absorbed into the Bowman's capsule, the U-shaped one. From there, it's converted within the PCT. That's mean PCT means proximal convoluted tubules. Then it comes through the U part of the nephron, that's known as Bowman's loop. See, that's Bowman's loop. From there, it goes through the DCT, that's P and that's D. D for distal convoluted tubule. Distal means which is away, means far away, far from the kitchen. You can say it's the kitchen where urine is formed. And after that, it collects into the collecting duct, and then it's the other parts from here. Another this like this. Another DCT is connected from here one, from here one, and from here one, like this. Many DCTs are connected here, and this is known the general collecting duct. From this, urine is collected into the urinary sac. So again come to GTT. So glucose tolerance test. GTT is the glucose tolerance test, which is the actual test of proper sugar patient or high diabetic patients. The patient must have been taking carbohydrate-rich diet for last 2 to 3 days, and his or her all types of sugar medicines has been stopped for those 2 to 3 observation days. After the 2 to 3 days complete, then he or she comes to the diagnostic center or the lab where the procedure starts. The subject means the patient should be directed to intake 75 gram glucose with 300 ml of water in every 5 minutes. Okay, so 75 gram glucose you can measure into spoons and mix them with 30 ml of water, 300 ml of water in 5 minutes. And blood and urine samples are collected within every half an hour. Okay, so every half an hour for 2 hours mean 4 times of collection for blood and both for urine. Then the interpretation comes. If fasting range is within 75 to 110 and peak in half an hour to 1 hour is 140, means first time fasting sugar, if the patient's fasting sugar first times is 110 and then after half an hour to 1 hour it peaks into 140 mg per TL, then it gradually falls. Okay, and according to WHO criteria, who you all know that World Health Organization. So according to WHO criteria, if patient suffers from DM, diabetes mellitus, and if his or her sugar fasting is greater than 126 mg per TL, okay, see carefully, sugar fasting is greater than 126 mg per TL, and sugar fasting after 2 hours mean the fourth time test sugar. Okay, the fourth time sugar value is greater than 200 mg, that's positive. And example, see here, this one is sugar fasting is 125 and after 1 hour first time sugar test is 180, second time sugar test is 150, and third time sugar test is 135. That's an example of sugar is gradually increasing and GTT result is proper.